I was honored and humbled and accepted President Trump's call to service because I understand what is at stake. I have never stood on the sidelines of our nation's healthcare debate, merely pointing out what is wrong with our healthcare system. More than 20 years ago, when I graduated from college, I started my career working on national policy on behalf of people with HIV and AIDS, as well as for low-income mothers to improve birth outcomes. I fought for coverage, greater healthcare access, and for improving the quality of care, and have continued to fight for these issues for the past 20 years. But I am deeply concerned about the state of our healthcare system, as there's frustration all around. Many Americans are not getting the care that they need, and we have a long way to go in improving the health status of Americans. Doctors are increasingly frustrated by the number of costly and time-consuming burdens. Healthcare continues to grow more and more expensive, and the American people are tired of partisan politics. They just want their healthcare system to be fixed. And I know this not simply because I've worked in healthcare, but because of how intimately it has affected my own personal life. My mother is a breast cancer survivor due to early diagnosis and treatment. And a few years back, my neighbor Aiden was diagnosed with a stage 4 neuroblastoma. He was only 4 years old. A large tumor had been growing for some time, maybe since he was born, and it was wrapped all around his kidney. Aiden went through excruciating, painful chemotherapy, radiation, stem cell treatment, and surgeries, all experimental. This May, Aiden will celebrate his 12th birthday. And both my mom and Aiden are testaments to the grace of God and the ingenuity of the American healthcare system. This is why people travel from all across the world to get care in the United States. I want to be part of the solution, making sure that the healthcare system works for all Americans, so that families like my own and Aiden's have the care that they need. I want to be able to look my children in the eye and tell them that I did my part to serve my country and to have a voice for people that don't often have one. This is a formidable challenge, but I am no stranger to achieving success under difficult circumstances. My father left his entire family to immigrate to the United States during the 1960s and pursued 4 degrees while working to earn money. On my mother's side, my grandmother was married at the age of 17 with no more than a 5th grade education. But my mother went on to be the first woman in her family to finish a master's degree. My parents made a lot of sacrifices along the way to provide me with the opportunities that they didn't have, and have taught me the value of hard work and determination. I'm extremely humbled as a first-generation American to be sitting before this committee after being nominated by the President of the United States. It is a testament to the fact that the American dream is very much alive for those willing to work for it. And it is my dream and my passion to work on the front lines of healthcare to improve our system. Throughout my career, I have brought people together from all sides of the political spectrum to forge solutions that worked for everyone. One of my proudest moments in my career was watching the Indiana legislature pass the Healthy Indiana Plan, which was a program for the uninsured, with a bipartisan vote. CMS is a $1 trillion agency and covers over 100 million people, many of whom are amongst our nation's most vulnerable citizens. Providing high-quality, accessible health care for these Americans isn't just a luxury. It's a necessity and often a matter of life and death. Should I be confirmed, I will work with CMS team to ensure that the programs are focused on achieving positive health outcomes and improve the health of the people that we serve. To achieve this goal, I will work towards policies that foster patient-centered approaches that increase competition, quality, and access while driving down costs. Patients and their doctors should be making decisions about their health care, not the federal government. We must find creative ways to empower people to take ownership for their health. We should support doctors in providing high-quality care to their patients and ensuring that CMS's rules and regulations don't drive doctors and providers from serving the people, our beneficiaries. If confirmed, I will work towards modernizing CMS's programs to address the changing needs of the people they serve, leveraging innovation and technology to drive better care. I will ensure that efforts around preventing fraud and abuse are a priority because we can't afford to waste a single taxpayer dollar. I will work towards ushering in a new era of state flexibility and leadership to drive better outcomes.